Now, when you say curve of the spine, maraming curves kasi yung spine. But basically, yung originally na meron tayo is called your primary curve. If you look at here, yan, nakasulat dito, cervical secondary, thoracic primary, lumbar secondary, sacral primary, diba? Initially, or from the very beginning, as soon as you were born, the curve that we have in our spine is called primary curve. And that primary curve looks like a letter C. Letter C. Kasi if you imagine, when you were inside the womb, ano ba yung position natin inside the womb? Di ba naka-fetal position ka? Parang naka-close up yung entire body mo. That's the primary curve that we're talking about. It's the C curve. Normal yun. It's normal. Now, as a baby, as you start lifting your head up, diba? You start lifting your head up, you start exploring your surroundings, tsaka nagkakaroon ng cervical curve, yung secondary curve. And once the baby starts sitting, nagkakaroon ng lumbar curve, which is also a secondary curve. Okay, now, I know these terms might seem a lot, but I'll just throw it out there. If you observe yung cervical and lumbar curve, they're the same. If you observe the thoracic curve and the sacral curve, they're also the same. In a sense na, yung cervical and lumbar region naka-push towards sa harapan, towards your belly button or towards your face. That's the front. The curve pushes towards the front, while your thoracic and your sacral curve pushes towards the back. Again, cervical and lumbar pushes towards the front. It's called your lordosis. If you've heard this, lordosis. Now, your thoracic curve and your sacral curve, it pushes towards the back or is curved towards the back or concave towards the back. It's called your kyphosis. So again, normal curves yun, ha? If you see on your x-ray lordosis, kyphosis, just know that it's normal. Lordosis, kyphosis, lordosis, kyphosis. And again, these are natural curves in the spine. The primary and secondary curves, natural yan sa spine. But that's from a lateral view. Di ba nakagilid yan, side view? That's from a side view of the spine. But pag ginawa mong front view or kahit back view, we also call the front view an anterior view. We call the back view a posterior view. Pag tiningnan mo yung spine from these views, the anterior and posterior view, dapat diretso lang siya. Wala siyang primary, secondary, wala siyang lordosis or kyphosis. Nangyayari lang yung mga lordosis and kyphosis na yon sa lateral view or when you're looking at the spine from the side. But when you're looking now at the spine from a front view or a back view, dapat diretso lang siya. Dapat diretso lang siya, as you can see from the picture. But again, this is where you can actually diagnose or see the scoliosis in a front view. Sa x-ray nyo, yun yung, if you've gotten your x-ray in the past and if you're gonna ask me what x-ray it is, the best one is scologram, but you're gonna ask from your doctor in the event that you need an AP lateral view of the cervico-thoracic the cervico-thoracolumbar spine x-ray. Because we're gonna look at the entire spine when we're looking at scoliosis. Hindi lang cervical, hindi lang thoracic. Kasi in the past, and even recently, a lot of my patients have been showing me their x-rays, and ang pinapakita lang nila sa akin is yung chest x-ray. Pag chest x-ray lang yun, largely lang makikita mo doon is yung thoracic spine. Hindi mo makikita yung cervical, hindi mo makikita yung lumbar. Pati yung sacrum, we also assess. Yan yung sa may hips natin. It's also very important that we notice these things and we look at these things. So again, when you're saying X or when you're saying scoliosis, usually you will be able to see it in an X-ray largely from an anterior or posterior view. Okay, and with that, we are just going to somehow tweak how we define scoliosis. Scoliosis is not just actually a side bending of the spine. As you can read here, scoliosis is a multifactorial, three-dimensional spinal deformity that always involves elemental deformities in the three main planes of the body. Let's just stop there. When you say three planes of the body, di ba? When you draw something on paper, that's two-dimensional. Us, as humans, and the world we live in, this is three-dimensional. Three-dimensional yung world na ginagalawan natin. Now, yung body rin natin, three-dimensional. It's just fact. It's not a matter of debate. Talagang three-dimensional beings tayo. When you say three-dimensional, we have, in the medical sense, we have the sagittal plane. Yung sagittal plane, hinahati niya yung body into a right and left. When you say coronal or frontal plane, hinahati niya yung body front and back. Now, when you say transverse plane, hinahati niya yung body in a superior and inferior, or a top and bottom. So that's basically the three planes of the body. Now, as we redefined scoliosis, it says here that it involves deformities in these three planes. So when you say that the scoliosis, or when the scoliosis involves these three planes, it involves the sagittal. Sagittal meaning, dyan mo makikita sa scoliosis, okay. Dyan mo makikita, I'll just come back here. Okay. Oop, hindi pala. Wala pala. Sorry, I'll just move forward. Here, there I go. When you say sagittal plane, basically, ito yung makikita mo sa sagittal plane eh. Yung lordosis and kyphosis and all that. Now, when you say scoliosis and it involves deformity in the sagittal plane, we said that in this view, in this lateral view, di ba dapat may lordosis ka sa cervical, kyphosis ka sa thoracic, lordosis sa lumbar, and kyphosis uli sa sacrum, sa sacral area. But what happens is, for scoliosis patients, ang nangyayari, nagiging flat back. Nagiging straight rin siya. Which is dapat hindi. Nagiging straight din siya. It means that there's a lot of muscle tightness that pulls the spine into a straightened position. Kailangan mo lang maging straight yung spine in an anterior or posterior view, or in a front or back view. But in a lateral view, kailangan mo tong primary and secondary curves ng spine, because they are important in distributing your entire weight. It's important in accepting the ground force as soon as you start bearing weight. Yun yung functions ng yung curves ng spine na yan. So pag nawala yan, tsaka nagkakaroon ng maraming pains in the body, pains in the back. So again, we're gonna go back here. Now, when we're talking about coronal plane or frontal plane, ito yung very basic that everybody sees in their x-ray. Nakikita mo yung deformity na ng spine, which is yung lateral side bending. I'm sure you've seen a lot of x-rays posted in the group. You see that in the coronal or frontal plane. Now, another thing, most important thing in actually scoliosis, for it to be identified as a structural scoliosis, di ba kanina may dalawa tayong scoliosis, non-functional and functional. Yung non-functional, madali lang siya i-manage. Madali lang yan i-manage. Masasabi mo lang structural scoliosis, ang isang scoliosis is kapag there is deformity in the transverse plane. Kasi dyan sa transverse plane na yan, imagine I'm the spine. Ako yung spine. Ito yung front view ko, right? Ito yung front view. And usually sa spine mo, may mga naka-attach na ribs dyan, right? These are the ribs attached to me. What happens in this transverse plane in a structural scoliosis is the spine turns. The spine rotates. And pag nag-rotate yung spine, imposibleng hindi gagalaw yung ribs kasi doon siya nakakabit, di ba? So what happens is, as the spine rotates, the ribs also rotate. Kaya for a lot of scoliosis patients, pag kinapa nila yung ribs nila dito, will feel, ay, yung isa nakaumbok. And when they do a forward bending test, it's called yung Adams test. You can look this up later. Adams test. ADAMS, Adams forward bending test. Yun yung one of the most basic tests we do to really see if there is scoliosis. When you say forward bending, tatayo ka lang, tas bend from your hips, bend down. What you see in an Adams forward bending test is may posterior rib hump. Merong hump sa likod. Na pag instead na smooth yung back, meron parang nakaangat. And again, that's a rib hump. And it's a rotation of the ribs and the spine in that transverse plane. Now, once you see this rotation of the spine in the transverse plane, it is very safe to say that that is a structural scoliosis and it needs to be managed. Is everybody clear? So we've just expanded our knowledge on scoliosis a little bit. Okay, so moving forward. Okay, so knowing that scoliosis is a three-dimensional deformity of the spine, it's safe to say and believe that a scoliosis-specific exercise should also target the three-dimensional deviations of the spine. Kasi the webinar is all about exercises, right? Scoliosis-specific exercises. But honestly, a lot of people are doing a lot of exercises that are not scoliosis-specific. Is it safe? It depends on who's teaching it and it depends what the exercises are. But more or less, kung anumang exercise yung ginagawa mo na hindi scoliosis-specific, it will not help your scoliosis as fast as it would kung scoliosis-specific exercise siya. So again, any exercise is good, but a scoliosis-specific exercise is great. Okay. Because why? Because a scoliosis-specific exercise targets yung three-dimensional deformities of the spine. Yun. That's why you're always looking for scoliosis-specific exercises. Kasi lahat ng problems you address. Okay. Okay, so looking here, these are the things that we look at. By the way, I'm a Shroff Method practitioner. We'll talk about Shroff Method more later, but basically Shroff Method is the gold standard in terms of managing scoliosis conservatively. Conservatively meaning hindi tayo magsa-surgery. Okay? And for a lot of the people in the group, they want to avoid surgery. I think everybody wants to avoid surgery. So again, our option is going the conservative route, and that is through exercises. Now, even before you start your exercises, you would always have an assessment. If you're with somebody who does not do assessments, it's very safe to assume na parang bara-bara lang yung exercise na ginagawa nyo. And it's not really scoliosis or curve specific. Because again, assessment is very important. Assessment is as important as the exercise. Okay? Now again, when it comes to assessment, these are the things that are largely taken into account from a posture. Of course, X-ray is one thing that I really, really need to be able to start with anybody. But if I don't have that, then I look at these things in a postural standpoint. We're going to look at the feet, the legs or the knees. I'm going to look at the hips. Yung hips kasi, ito yung hips mo, right? Hips. Ito yung hips mo. Yung hips mo, pwede siya mag-tilt. Right? Pwede siya mag-tilt. But, yung hips mo, pwede rin siya mag-rotate. Pag ganyan. Yung hips mo, pwede rin siya mag-tilt forward, mag-tilt back. So there's a lot of movement in the hips. Kaya kailangan mong i-assess yung hips. Hindi lang siya nagtitilt up and down to the side. It also spills forward. It also spills back. It rotates this way. It rotates that way. So you have to assess the hips. The trunk, I will show you the trunk later. Shoulder blades, I will show it to you later again. And of course, the shoulders. I think I have it here. So this is from one of my recent patients. Amanda is one of the people I want to thank because I was able to start with a group of preteens. Preteens means they're in their 12, 13 years old. And this is the crucial stage. Crucial stage because dyan nagsa-start yung growth spurt. Okay. Let me just go back here before we go to this slide. When you say growth spurt, it's very important kasi to catch yung scoliosis at a really early age. Usually that's between 10 to 15 years old. In advanced countries, part ng school system nila yung scoliosis screening. Pero of course, dito sa Philippines, wala. Wala tayo. Wala tayong scoliosis screening. So again, but in advanced countries or in more developed countries, it's part of their school system that the kids are screened as early as 10 years old kasi that's when the growth spurt happens. For women, it's an indication that they're at their growth spurt once nagkaroon na sila ng menstruation. So part ng assessment and questioning for us, for those who practice Shroff, is when did the girl, lalo na pagbata, when did the girl have menstruation? When did she first have her menstruation? If hindi pa nagsa-start yung menstruation ng bata, ibig sabihin na pag nag-start yon, once nag-start yung menstruation ng bata, there's a big chance na mas bibilis yung pag-curve ng spine, pag-curve ng scoliosis. So gusto mo siyang i-catch or gusto mong maging aggressive sa treatment mo at that point. Kasi nilalabanan mo yung growth spurt eh. Yung growth spurt, basically, it just messes up the whole program because it just keeps on increasing and increasing the curve. So yun yung gusto mong kung bakit mo siya gusto i-catch at an early age. That's for girls. But for boys, ang indication of growth spurt nila is yung pubic hair nila once it starts sprouting. So again, that's part of our line of questioning. And I'll dive on that more later. So here, let's come back to this. So we mentioned about the feet, right? For a lot of people with scoliosis, we also try our best to manage yung flat foot, yung flat feet. When you say flat feet, I'm gonna show you my foot, guys. Wait lang. I'm gonna show you my foot. I hope it's okay, Amanda. So when you say flat foot, let's stand up. So when you say flat foot, right there, flat foot. When you say flat foot, diba, can you see the curve or parang yung curve here? We call it medial arc. Medial arc. May arc siya. When you say flat foot, walang medial arc. Naka-flat siya sa floor. With that medial arc kasi, what happens is, again, function ng mga arches sa foot, and you don't have just one arc sa foot. There's actually 3 arches in your foot. But that's one of the most prominent things, yung medial arc. Yung medial arc na yon, pag flat-footed, pag umapak sila lalo na sa floor, ito yung flat, ito yung medial arc. Pag inapak nila yan sa floor, dapat lulubog yan. But what happens pag flat-footed is completely naka-flat siya sa floor. You can't insert any of your fingers. So that's what flat feet is. And it becomes a problem for people with scoliosis, or it's part of what you want to manage, because if you can see my pointer, my mouse, right? Rizzy, can you see my mouse? Okay. So if you can see here, try to look at where my mouse is pointing. Look at this right leg of our girl. It's basically straight. But just know that her left foot is more flat compared to her right. Mas flat siya sa left. So if you can see the leg and how it deviates, can you see the difference of the right leg, which is more straight, and the left leg na mas medyo naka-angle out, right? We want to catch that at an early age because if hindi na manage yung flat foot, basically yung purposes ng arches sa foot mo is to transmit the ground force. Yung ground force, as soon as sumapa ka, may ground force na aakyat sa foot mo. Once that comes up to the foot, it will go up your leg, it will go up your knee, it will go up your hips and your spine. That ground force will go straight up into the body. The function of the arches of your foot is to distribute that ground force evenly. Now, pag flat foot ka, yung distribution ng ground force is not even. So what happens is nagkakaroon ng deviations, compensations, and torsions sa leg. As you can see, this leg parang naka-curve na siya. And, sige, you say, okay lang naman curve. But the problem is, kung curve siya, may indication yan na magkakaroon ng knee problems or as early as this age, nagkakaroon na siya ng knee pains. And if there are knee pains as early as this patient is in her 13, she's 13 years old, if she's having knee pains as early as this, what more pa in the future? As she reaches her teens, as she reaches her adulthood, diba? If as early as now may knee pains na siya, so you want to correct that. So again, part of the management is yung we look at the feet, we look at the legs, we look at the knees. And if you can see, we're gonna go back here to where I'm pointing at, we're gonna look at the hips. And with the hips, you can see that the right side, if you can see, the right side is hiking up more than the left, right? Yun, yung hips mas mataas sa right side. But again, hindi lang naman yung tinitingnan mo sa hips eh. Naka-tilt ba siya forward or naka-tilt siya back? Is it rotated to one side or the other? It's not just a tilt on one side. A lot of things are happening in the hips. So that's also one of the things you should look at. And we mentioned earlier, hold on. After the hips, we're gonna look at the trunk. If you can see the trunk, look at the entire profile of the girl. Yung trunk niya naka-lean towards the left. Kaya it would seem that her head is trying its best to be midline. Can you see it? Look closely to where I'm pointing at. The entire trunk. The entire trunk. Dapat between the heels or between the ankles, straight up, dapat naka-fall dyan sa one straight line na yan, yung spine and the back of the head. But for her trunk is leaning to one side, right? Can you see? Yeah. So again, that's one of the things that happens. Nagkakaroon ng listing of the trunk. It lists either to the left or to the right. So again, that's one of the things that we also check. And if you can look at the shoulder blades. Look at the left shoulder blade here and the right shoulder blade here. Right shoulder blade, mas nakalabas siya. And it shouldn't be. Dapat, as much as possible, naka-pull in siya. Naka-pull in, naka-retract. Kasi that, pag naka-push out siya or naka-protract, it means there's weakness on that part of the back, that upper back. Now, this is our before picture. And this after picture is just after 10 sessions. And with the 10 sessions, her shoulders evened out more. Yung trunk niya mas nag-fall to midline. this right shoulder blade was able to pull in. Hindi na siya masyado naka-push out. The hips didn't drop as much as I wanted to, so we'll keep on moving forward. But again, this is the back view. We're gonna go to the front view. Again, you can see the shoulders are much more even. The hips, although it dropped, I want to drop it some more. So we'll keep going with our exercises. And this is another person. Ito, I want you to look at the side. If you can see here, sa before picture, there's also listing of the trunk. Listing towards the left. She's more at the middle after 10 sessions. Now look at the side view. Remember when I said about primary curves and secondary curves na they're normal? And the abnormality for scoliosis and the spine in a side view or lateral view is pag naging straight siya. This is the same for this patient. Her primary and secondary curves appear to be just one curve. Parang nag-straighten yung back niya, right? Nawala yung lordosis sa may lumbar area. Parang naging kapantay na lang siya ng thoracic or ng upper back. So again, that's one of the things that we try to correct. And after 10 sessions, nag-increase yung lordosis niya. But also, if you can see this shoulder, whatever happens, everybody just know that whatever happens to the shoulder is also happening to the shoulder blade. So if this shoulder parang naka-push siya forward, meaning yung shoulder blade mo on that side, on this right side, is also nakalabas. And again, after 10 sessions, everything just started pulling back in. Kaya mas naka-center na tong shoulder na to on the right, on the after picture. But again, yeah. So next topic, what is the foundation of any scoliosis-specific exercise? Now, before we continue on with this second topic of the webinar, again, if you have any questions for the previous topic, just put them on in the chat box so you don't forget. And here, moving forward, what is the foundation of any scoliosis-specific exercise? Basically, it's your core muscles, proper breathing. This is not emphasized enough, and we'll try to do it today. And it's your ADLs. ADLs means your activities of daily living. Okay, so we're gonna go ahead. There. So when you say core, for a lot of people, when narinig nila yung core, ang iniisip nila parati is abs or yung six-pack abs. But no, that's just a part of the core. Part lang siya, and it's a small part. It doesn't mean na if may six-pack abs ka, malakas yung core mo. For a lot of people who don't know how to exercise and just make or put it upon themselves to do so, and habol lang nila is yung aesthetics or yung look ng six-pack abs. If yun lang yung habol nila, what they usually do is a lot of crunches. They try to make those abs appear. But again, it doesn't mean that they have a strong core. For a lot of people who have six-pack abs, they still have a weak core. Because when you're talking about core, as it says there, your core is a cylinder. Cylinder siya. Hindi siya nasa harapan, hindi siya nasa likod, or nasa side. It's a cylinder. Paikot siya, may top, may bottom. It's a 360-degree wrapping of the muscle. It has a top, it has a bottom. The core is a cylinder. And at the front of that cylinder are your abdominal muscles, your superficial, meaning yung nasa pinakalabas, and your deeper abdominal muscles. On the sides, you have your obliques. At the back, of course, you have your back muscles. That includes your shoulder blade muscles, if you heard me saying that before. And we covered yung 360-degree ng trunk, right? The front, the back, the sides. But there's also the top and the bottom. The top The top of your cylinder is your diaphragm. Diaphragm, if you remember from grade school, yung basic body ano natin, body identification subject natin. Ano bang science yan? In science. So in science, we've heard the word diaphragm before. For a lot of singers, they know about diaphragm because this is where they get their voice. They know about this and they're great at this. The top of your core is your diaphragm and the bottom is your pelvic floor. Yeah. So just know na yun yung core, ha? We're gonna come back to that. Okay. So, okay. As you can see from the video, right? Try to watch the video carefully. Can you actually tell kung kailan siya nag-i-inhale? I'm gonna play it again. Yeah. I-inhale siya, no? Inhale, the chest comes up, right? Can you notice the chest coming up when she breathes in? Yeah. But actually, mali yun. Mali siya. Proper breathing is already enough to strengthen the core. And everybody knows how to properly breathe as soon as we are born. We are born with it. But due to the dictates of society, due to posture, due to our occupation and the things we do every day, it gets corrupted, it gets changed. So we're gonna look at babies. If you have a baby, just observe your babies at home. If you have like 1-2-year-olds, or if you can remember how babies are, how babies look like. Ang pinaka-most na, no? Pinaka-most. yung pinaka-prominent sa babies, aside from their big head and big eyes, is their big belly, right? Their big belly. They have big eyes, they have big belly, they have big head. So we're just gonna look at the big bellies of the babies. Because when they breathe, when babies breathe, if you look at them, they don't breathe like this girl at the bottom na umaangat yung chest niya, nag-heave up and down. Babies do not breathe like that. Babies actually breathe this way. Syempre, siya may six-pack abs, no? But try to look at a baby when they breathe. Yung belly yung umaangat. For babies, when they breathe, yung belly yung umaangat. The belly, and it's not just the belly, it's a full expansion of your cylinder. Diba? We're gonna come back to this. The core is a cylinder. And your diaphragm being at the top, this is your diaphragm, guys. When you breathe in, this diaphragm, it flattens and pushes everything down. Again, inhale, you're gonna flatten the diaphragm. Exhale, it will lift up. Inhale, exhale. Inhale, exhale. Yun yung function ng diaphragm natin. When you inhale, it pushes down. It flattens. So when the diaphragm pushes down, of course, it's an effort going down. Lahat ng structures underneath ng diaphragm, lahat ng visceral organs mo dyan, lahat ng organs mo dito, lahat ng muscles mo in your trunk will also be moving in compensation or in relation to the diaphragm on top. Kasi what happens on top will just cascade down. In the same way na what happens at the bottom will just go up. Diba in ground force, it goes up. For this one, the breathing, when the diaphragm pushes down, it's gonna push down everything that's underneath it. Kaya when you inhale, lumalaki yung buong cylinder. So when you breathe in, it's not just the belly moving forward. It's not just the belly moving forward. It's the entire cylinder expanding and slowly coming in. Again, when you breathe in, it's an entire expansion of the 360 degrees and it comes back in. That's proper breathing. Hindi lang yung harapan. The sides also breathe. The back, whether you believe it or not, it also breathes. It moves to the back. It expands. So that's what happens when you breathe properly. But we also have to think of the bottom, the pelvic floor muscles. Since everything is pushing down and expanding, of course, since nag-expand yung nasa taas, yung mga organs mo, what happens is, this is the pelvic floor. It's also gonna move up and down in relation to your breath. And that movement, that simple breathing alone and movement of your muscles just from the diaphragm and breathing is enough to strengthen the core. That's already enough to strengthen the core. But again, for a lot of people, they have lost this ability of that 360-degree breath. And what happens is they just become chest breathers. Others, when they make an effort, they do belly breathing. But again, we don't want belly breathing. We want a full diaphragmatic breath wherein yung 360 degrees ng trunk mo is moving. Now, this, when I say this is the foundation, I'll explain it through the derotational breathing. Sorry, wrong spelling yan. But let's just do a very quick exercise here. Everybody, if you can sit up with me. I'm actually on the floor, and I always like sitting on the floor. So from here, everybody sit upright. Make sure you're not collapsed, you're not slouching, but you're holding yourself up away from that backrest, right? You've got a straight spine, or as much as you can straighten it out while still feeling comfortable. And this might feel weird or unfamiliar, but everybody just place one hand on your chest, and one hand on your belly. Clip your elbows by your sides. Is everybody there? Yeah. So everybody from here, begin to close your eyes. We're not going to do anything weird. I just want you to close your eyes so that you have a better awareness of what's going on in your body while you breathe. Okay? And from here, we're going to make a conscious effort of inhaling and exhaling. Keep breathing and try to observe which hand moves more. Is it the top hand or the bottom hand? And while you're there, the bottom hand, right? You have that bottom forearm. And in that inner side of your bottom forearm, you can feel for the sides of your ribs. Do you also feel your breath able to move to that side? So let's come back to the basics. Eyes are closed. Just feel for which hand is moving more, the top or the bottom. And I'll give you 2 more breaths here to really try and analyze and memorize the feeling of your breath. 1 more, inhale and exhale. Okay, everybody open your eyes. Now, where did you feel your breath? Was it more of a chest? Or was it more sa belly?
It's more in the belly for mine.
Okay, so whoever said that,
Belly.
good job on you. Rizzy, where did you feel your breathing? Chest,
Chest.
chest, chest, chest. Okay, Amanda. I know Amanda. Hindi. Alam ko na. Alam ni Amanda yan. Correct answer.
Belly. Yeah.
He knows it.
Yeah.
But again, chest breathing and belly breathing, maybe we have 50% of our attendees are feeling chest, 50% are feeling their belly. But again, once you have this awareness, just know that you should always be shifting into a belly breathing. And why? Why do we want that? Because, again, simply by tapping into your diaphragmatic breath, you're already strengthening your core. And at the same time, once you say diaphragm, diba, diaphragm, it's a primary function ng diaphragm muscle because it is a muscle. That yung primary function niya talaga is for breathing. It's for inspiration and expiration. It's for inhalation and exhalation. Yun yung main function ng diaphragm. Yun yung primary muscle natin for breathing. Primary muscle for breathing is diaphragm. What are our secondary muscles for breathing? Yung secondary muscles natin for breathing are the neck muscles. The neck muscles. And I'll let you digest that for a few seconds. Primary muscle for breathing, diaphragm. Secondary, neck muscles. When you say secondary, it means hindi niya main function yun. It's just a support. It's an adjunct. So what happens is, if you are a chest breather, anong nangyayari? Any movements with your arms, with your neck, madaling ma-fatigue yung area na to. So for a lot of patients with scoliosis, because just know everybody that scoliosis does not always equate to pain. A lot of people with scoliosis do not have pain. And if they do have pain, it is easily correctable with the proper breathing and proper exercises. And for those who are having a lot of pain here in the upper back, just correct your breathing. Kasi pag kinorek mo yung breath mo and you tap into your diaphragm, if you turn on your diaphragm, your secondary muscles on the neck will turn off. And once it turns off, it means they're able to rest. Kaya lang naman sumasakit yung sa may upper back mo kasi overwork na yung neck muscles mo eh. Because they're doing what the diaphragm should be doing. So again, that's diaphragmatic breathing. But we're gonna go into derotational breathing. That's more for the scoliosis. Again, because you can be, for a lot of patients lang kasi, with patients with scoliosis, they manifest that habit of chest breathing. But a lot of people without scoliosis are also chest breathers. Okay? It's not just because you're scoliosis kaya ka chest breather. Even if you're not a scoliosis patient, you still have the propensity to become a chest breather. But we're gonna go ahead into derotational breathing. Diba earlier, we were talking about the ribs. Like, I'm the spine and my ribs are turned, or my spine is turned. So the ribs, pag feel mo sa ribs mo dito, mas naka-protrude one side. Diba? So what happens is, with derotational breathing, you're not breathing in a 360-degree manner. This is one of the things that I do in assessment with my patients. I teach them derotational breathing, and it's breathing exactly for the curve that they have. Because although the diaphragmatic breathing is correct, it's not enough for what we want to achieve to correct the scoliosis. To be able to make changes for the scoliosis with as simple as breath, it's through derotational breathing. Kasi what happens is, okay, I'm the spine, I'm rotated this way. So, this part, itong hand na ginagalaw ko, ito yung side of the ribs mo na na-feel mo sa harapan mo, right? Ito yung naka-protrude sa harapan. So, it means this side is protruded. This side, that's at the back, is collapsed, right? But you have to think that this is just in the front view. If you're gonna think of the back view, and I can't really show it because I'm already in this position, protruded to the front, and this is collapsed. again, front view, everybody. Think front view. Front view, this side of the ribs, the hand I'm moving, this side of the ribs is the one protruded, and this side of the ribs is the one collapsed. Front view. Now, change your imagination and your understanding to the back view. I'm not going to change anything. This side is the one protruding at the back, and this side is the one collapsed at the back. Kasi di ba, nag-rotate. Just know that in derotational breathing, you should be able to breathe into the collapsed areas at the front and at the back. Dapat na-expand mo siya simultaneously. And it's not a 360-degree expansion anymore. It's a very segmented and directed kind of breath. So earlier, when you say diaphragmatic breathing, it's a full expansion of the 360-degree chunk, right? It's that kind of breathing. But when you say derotational breathing, this hand is the one in the front, this hand is at the back. You should be able to breathe like this. Doon lang siya nakadirect sa collapsed part ng ribs mo. And it's kind of hard to think of right now, and even harder to do, once you're starting with the exercises. But again, that derotational breath is the very key into addressing yung transverse deformity ng spine. Alam mo yung transverse deformity, yung rotation. It's the breathing alone that can address that. It's not any of the exercises that you do. It's not yoga or Pilates or whatever, CrossFit and whatever. They will never be able to address the derotation of the spine as simple as in terms of breathing. So it's very important that our patients learn about derotational breathing, because this is the breath that they will be using the entire time while they're exercising. Otherwise, we're always gonna be falling short. We're always gonna miss it. And we may not be doing as much good as we want, or we're not fixing things as fast as we want. Okay, so that's derotational breathing. I'm going a little bit over time, Amanda. Is that okay?
No problem. You have all the time. We can extend this. So it's a weekend, so everyone is excited to learn from this forum. So go over time. Yeah. Thank you.
Another thing, what's the very key of scoliosis-specific exercises? It's the activities of daily living. Because we call them ADLs. When you say activities of daily living, it's the majority of what you do. Majority of what you do is you sleep. How many hours of sleep? Diba? 7. You walk. Do a lot of walking. Maybe not now because we're in a pandemic. We're just stuck at home. You do a lot of standing. And if you have Netflix at home, I'm sure you do a lot of sitting. Yeah, mga K-dramas. We're just sitting. So those are our top 4 activities of daily living. Sleeping, which composes of 8 hours of our day. Sitting down. Can you guess how many hours of sleep or sitting down you do in a day? Maybe 4, maybe 5, maybe more. Standing up and walking. Because this is important to understand na yung exercise mo, yung scoliosis-specific exercise or whatever exercise pa yan na targeted for scoliosis, it's at the most going to be 1 hour per day. If you're really super good and super dedicated, you can do 2 hours per day na scoliosis-specific exercise ha. Hindi yoga, hindi Pilates, but really scoliosis-specific exercise. You can do at the most 1 or 2 hours per day. And that's really saying a lot already. But imagine, that is just one At the most, at the very best, that's 2 hours per day compared to your sleeping, which is 8 hours, compared to your sitting, which is 5, 6 hours, compared to your standing, compared to your walking. Maliit na percentage lang in your day yung madededicate mo for scoliosis-specific exercises compared to the activities of daily living. So, one of the things that I want to teach you now that you can already start doing is everybody try to stand up. Try to stand up. Are you guys standing up? O, ba't ka nakatayo? Hindi, joke lang. So,
Yeah, I'm standing up.
yeah. Once you're standing up, I'm gonna hold on. So once you're standing up, I'm just gonna show you. So once you're standing up, you're trying to feel for your hip bones here, web of your thumb and your index finger. Open them up, palms are facing the floor. Just feel for your hip bones, right? Did you feel the bone, guys? Did you guys feel bone there? Yeah. Just push it in and try to see which side is higher. Anong side ng hips mo is higher, the right or the left? Some of you might even feel na mas nakaluwa yung isa pang side, right? So, once you've identified which of your hip is higher, you can sit down. Upo na tayo. So, there you go. So, were you able to identify which side was higher? Right?
Yes.
Just know that higher side, you always need to make an effort, be resourceful. You need to make an effort into always dropping it down. So if you're right, or if this hip is higher, pagpalpate mo, paghawak mo parang nakaganyan, hindi pantay, mas mataas tong side na to. Then when you cross your legs, make sure that this side goes on top. Again, if this side is higher, is this your left side, diba? You see this as your left, right? This is your left side. If your left side is higher, make sure that when you sit down, you always cross your right leg on top of the left. Because in that way, you already drop the right hip and you elevate. You already drop the left hip and you elevate the right. And again, whatever happens to the hips, if you have a curvature here at the low, sige, ito yung hips mo. Ito yung lower spine mo, yung lumbar area mo. Whatever happens to the hips, the spine, the lumbar spine will always compensate. So if nakaganyan yan, and nakaganyan yung curve mo sa lumbar spine, yan, ganyan, nakaganyan yung curve. Whatever happens to the hips, once you start correcting it, there will also be correction that will happen and go up on the lumbar spine and on the rest of the spine. That's why it's very key in managing or in conservative management of scoliosis, yung hips. But again, that's only one of the simplest things that you can do every day from now on. If you're not a fan of crossing your legs, what you can do is, you can get, wait, what you can do is you can get a towel. Kasi a lot of, if there are moms listening, diba your kids, they do a lot of online schooling. And in online schooling, they're sitting down. As much as possible, you want them to sit properly, right? So what you can do is, if you don't want them crossing their legs, what you can do is you can fold a towel. And kung etong side yung mas mataas, if the left side is higher, you want to bring that down. So you put the towel underneath the right hip. Yung sapong-sapo yung buong butt cheek. So when you put it on this side, the right side elevates and the left side na initially mas mataas now is forced to drop. Again, right? And when I say scoliosis-specific exercises, we largely teach on ADLs, techniques for sitting down, sleeping, and standing, because again, these make up a bigger or bulk of the time of the day of the person. And that's with regards to your hips. But when you stand, that's sitting down, right? Now, when you stand, I'm going to show you. I'm wearing shorts so that you guys can see. When you stand, so basically, hold on. So basically, when you stand, right, these are my knees, right? This is my right knee. Just to know everybody that this is my right knee, and my right knee, my right hip is the one that's elevated. Siya yung mas mataas. So when I stand, what you're gonna do is as simple as bending the right knee. Because when you bend again the right knee, that right hip drops. And you have to stand this way every day you stand from now on. Again, were you able to get that? You have to be able to do something about your sitting. You have to be able to do something about your standing. That's why it's important na if you didn't do it earlier, you can do it now. Na feel for which side of your hips is higher, because you can already start adapting those two things. And if you're very creative, if you're the kind of person who already does a lot of exercises, you can maybe even then start recreating your exercises in such a manner na parating naka-drop yung hip na mas mataas. That's one of the things you can do. And I can't really say anything about sleeping right now because it's kind of hard to do. Especially, I don't know the different curves of the people here in the group. But again, there's a lot of techniques. You can get this from a side lying position and just have bolsters here. It depends on paano yung curve mo. I'm sure you've heard this from your doctors, but you can also actually sleep in a lying down position. Lying down, meaning face up and your back is on the bed. And you just put a lot of wedges underneath your shoulder blades on your lower back. But again, it should be very specific to your curvature, to your scoliosis. And moving forward. Okay, early detection and intervention as the best management. Okay, we're gonna go ahead with this. I mentioned this earlier, some of these, I think. 85% of cases ng scoliosis are idiopathic. Again, idiopathic, hindi mo alam kung bakit ka nagkaroon. And it's not about pangit ka umupo nung bata ka or mabigat yung bag mo nung bata ka. It's not. It's idiopathic. Wala siyang pinanggalingan. But 30% of patients have a family history of scoliosis. So if you're a mother with scoliosis as early as 10 years old, 11 years old, pa-screen mo na yung anak mo for scoliosis because it tends to somehow run in the family. Okay? And again, from ages 10 to 15 is when scoliosis is most likely to develop. And it's important to catch it at this stage because ang growth maturity ng women stops at 18 years old. Ang growth maturity ng men stops at 21 years old. Diyan na nag-fuse yung growth plates. So from that onset, from 10 years old to 18 years old, ang nangyayari dyan, growth spurt lang yan ng bata or 10 to 21 for boys. Yung growth spurt na yan, yung 10 years na range na yan, when he's growing up, just know that the scoliosis, if it's undetected and you were not able to intervene at an early age, nag-grow lang rin yan. Palaki lang rin siya ng palaki. That's why you have to catch it. Kasi even like for the kids that I'm doing scoliosis right now, they were able to catch it at 12 and 13 years old. And they did their x-rays, and I'm planning to make them do their x-rays every 6 months, maybe a year, because it's hard to go out right now. But largely, we base it on the x-ray, hopefully, if they're able to get it. But if not, then we'll go to the postural pictures. And what you see in the x-ray is if you're catching, if you're able to catch yung scoliosis nila at an early age, kunwari a 13 years old and their degree is at 50 degrees na yung scoliosis nila, and after 6 months nakita mo 50 degrees pa rin yung curve, hindi nagbago. After 1 year 50 degrees pa rin yung curve, hindi nagbago. After 2 years 50 degrees pa rin yung curve, hindi nagbago. Is that a bad exercise? No, it's not a bad exercise. It's actually good. Because that's the age, kunwari lalo na, dun nagkaroon ng menstruation yung bata, at that age. Pag nagkaroon ng menstruation, puberty, parang growth spurt talaga yan, all and everything happening at the same time. It means that if you're able to catch it at that point, this is the point na mabilis mag-increase yung curve ng scoliosis. And with the x-rays that you're seeing, hindi nagbabago yung curve. It means that you were able to abate the progression of the curve. Then maybe at 18 years old, or maybe moving forward as she reaches her 15, 14, 13, then maybe you will see now that the 50 degrees curve will start decreasing. Pero it doesn't really mean that it has to start decreasing at that age that you caught it. Kasi nilalabanan mo again yung pag-increase ng curve. And again, 5 to 6 adolescent idiopathic scoliosis are female. It means, when you say adolescent, ito yung mga bata. Iba yung, I'll mention adult scoliosis more later. But maybe because yung adult scoliosis, they were undetected as kids. Kaya adult na lang nila nalaman. But maybe early on in their life, they already have it, but hindi lang, na-detect. So again, scoliosis is more common in women compared to men. But men, when they do have scoliosis, for boys, when they do have scoliosis, usually mas malala siya compared to girls. Again, girls are much more susceptible to get scoliosis, but when boys get it, it's usually much worse. Worse in a sense na either mas mabilis mag-progress or mas malaki yung curve. And this is a good news to everybody. Only 10% of people diagnosed with scoliosis will ever really need or require surgery. Not because your doctor told you you need surgery, you should immediately go for it. I'm not saying that they're wrong, but what I'm saying is that is their training. Because for us who are trained how to manage scoliosis in a conservative way, 10 degrees scoliosis, 15 degrees scoliosis, parang, I'm not so nervous about it. If it's 15 degrees and you're 10 years old, then I will closely observe yung bata. Pero if it's 15 degrees and you're in your 20s, 30s, parang, hindi ako concerned masyado sa ganun. But if the scoliosis is at 20 degrees, then I'll start doing management on it. Right? For adults, if it's 20 degrees and wala ka naman nararamdaman, will you want to manage it? It's okay if you don't want to manage it with scoliosis-specific exercises. But what I'll ask you to do is to observe. Once I say observe, meron kang 20 degrees scoliosis or 30 degrees, anything more, right? once you have or once you are able to detect in adulthood na meron kang scoliosis na more than 20 degrees, you have to keep doing your x-ray every year. Every year. Kasi if yung curve mo nag-i-increase ng 1 degree per year, so it means by the time you're 30, 40, 50, edi ibig sabihin yung curve mo 50 degrees na rin. Pag 60 years old ka, 60 degrees na rin. You have to catch that. If it's increasing 1 degree per year, then we have to do something about it already. Okay? And with regards to that, adults, yeah. So when it comes to scoliosis in adults nga, as I mentioned, di ba yung growth spurt, yung growth plates ng women, they fuse at 18. For men, it's at 21. When you say fuse, ibig sabihin mas matigas na siya, mas solid na siya, right? But for women, when you get pregnant, when we get pregnant, there's a hormone called relaxin. Relaxin. It's required. It's there in your body so that your hips will be able to expand as it can during childbirth, during labor. Whether you're opting for natural birth or whether you're opting for cesarean, talagang magre-release ng relaxin yung body mo. You cannot stop it. It makes your joints loose. Loose. Parang mas madaling, lumalambot uli siya basically. So, for women with scoliosis and have a big curve at that, they are encouraged, we actually encourage them to give birth past 30 years old or at 30, at the 30-year mark, because at that age, mas stable na yung spine nila. Mas stable na yung bones, mas matigas na yung bones nila compared to when they're in their 25s. Kasi once you give birth, again, with the relaxin, makes your joints loose, your spine is also gonna be loose somewhat, and you are more susceptible, or your spine is more susceptible again in that increasing curve. So mas lalala pa yung curve. So again, it's much more advised for those with bigger curves for them to get pregnant 30 and above. Okay. Oh yeah, scoliosis-specific exercises. We have a lot actually. So based on evidence, and you can search for this. The least, we're gonna go to least evidence to the most. So there are general exercises for scoliosis, mga plank, bridge, crunches, or whatever. Those are general exercises. Squats, they're all good. Again, any exercise is better than no exercise. Okay? Kung ayaw mo ng scoliosis specific, just move. Just move. For crying out loud, just move, just exercise. Because know that your bones, your joints, they are strongest when you put weight on them. Weight, right? So when I say exercise, do not just think of stretching. It's not just stretching. In Shroff Method, again, Shroff Method is the gold standard globally in terms of managing scoliosis conservatively. Shroff Method has no stretching. It is all strengthening. It is all resistance, body resistance. So again, least evidence mo is all the exercises out there. Yoga is even part of that. Pilates, kahit sabihin nilang Pilates for scoliosis, it's still Pilates. Not unless they say scoliosis-specific exercises, is it really for scoliosis? Then next to that would be your physiotherapy or your physical therapy. But again, as mentioned earlier, I'm a physical therapist and I'm not putting down our profession. But the way that physical therapy was taught to us in terms of managing scoliosis is very vague,
Exactly.
very I want sabog, wala siyang clear-cut method on how to address specific curves. Hindi siya malinaw. The way we were teaching or managing scoliosis in the clinics was very copy and paste. Yan, copy and paste. Ito. Yan, ganyan. We don't do much assessment. We have this general short assessment for scoliosis and a general copy and paste exercises for scoliosis. So, and again, it's better. Again, we're going from least to the most. Again, it's better than just doing your general exercises. And we also have dynamic neuromuscular stabilization. I like this. I also studied this. These are, just know that dynamic neuromuscular stabilization and Shroff Method are all post-grad courses. You cannot take it if you're not a physical therapist. Yung dynamic neuromuscular stabilization, I like it because aside from assessment ng spine, assessment ng tao, ng scoliosis, they also do assessment of how is the patient able to understand your cues. Meron ba siyang problem with hearing? Meron ba siyang problem with sight? Meron ba siyang problem with body kinesthetic or body awareness? Because the way that you convey your cues and all of these body informational cues to them is very important. Because if iba pala yung perception niya sa body niya compared to a normal person, kahit anong turo mo ng exercise sa kanya, hindi niya magigets kasi nga iba yung body spatial awareness niya. So DNS has that. And DNS, Dynamic Neuromuscular Stabilization, banks on the fact that you should be able to do a diaphragmatic breathing. A lot of their exercises are core-based. Core-based, meaning you have to have that correct pattern of breathing first. So that is dynamic neuromuscular stabilization. In Shroff Method kasi, now we're going to Shroff Method. Shroff Method kasi, you immediately jump to the derotational breathing. And then that's good. Different schools of thought, but they still work. But when it comes to evidences and success, ang pinakamagandang success rates na nakita namin in terms of our studies, and our school is from, our teachers are from Hong Kong. The Shroff Method is based in Spain. They're based all over the world. And all of our evidences lead to the fact that Shroff Method plus hard bracing is much more superior than Shroff Method alone. So again, hard bracing is important, most especially for kids. Kasi nga, yun yung gusto mong i-stop yung progression ng curve nila. So again, Shroff Method plus hard bracing is the most superior management, conservative management in terms of scoliosis. So if you're an adult and you were still advised to get braces, then good, because it might be that yung degree ng scoliosis mo per year is maybe at 1 degree or 2 degrees yung increase niya per year. So they're still trying to catch that. Okay, so here, when we say Shroff Method, again, Shroff Method is a non-surgical option for scoliosis treatment. It uses exercises customized for each patient to the curved spine to return the curved spine to a more natural position. The goal of Shroff exercise is to derotate, elongate, and stabilize the spine in a three-dimensional plane. So for Shroff Method, and this is also what I do, but I do an integration of my technique kasi. But I always require an X-ray before we start. Kasi ayokong naghuhulaan kami ng patient na, ay, sige, nag-improve ka na. Nag-improve na to. From the postural pictures before and after, nag-improve na. Yes, there could be a big improvement in the postural pictures before and after. But you will only really see that it's changing and it's working through that before and after X-ray. So X-ray pa rin, para walang dayan. So here. Considerations with regards to Shroff exercises or scoliosis-specific exercises. Number one most important thing is the level of participation. When you say level of participation, if you're just gonna tell me that you will only have twice in a week to be able to do the exercises, then I might not accept you in the program. Because I want and I require all my students, my clients, my patients to do the exercises every day. Every day. If they're gonna rest, they can rest for 2 or 3 days. But again, they should have at least 4 to 5 days of exercise in a week. If you're doing it at 2 days a week, parang wala siyang kwenta. Kasi 1 hour lang yan. So 2 hours in a week mo lang siya ginagawa. So again, you have to do it every day. And for a lot of my kids that I'm handling now, they're in their preteens. I really put it on, and this is kind of a real talk. I put this on the parents. I really put the responsibility on the parents. Because at that age, na mga 10 to 15, kahit 16, kahit 18 pa nga eh. Kahit 18 years old pa yan. They're still basically kids. Essentially, they're still kids. Hindi sila, well, I won't sugarcoat this, tamad sila. Tamad talaga. Lalo na, hindi sila yung nagbabayad ng sessions nila. Of course, if you don't pay for it, you won't find the value eh. Normally, if you don't pay for something, you won't find the value in it. So if you're paying for your sessions and tatamad-tamad yung bata, the parents really have to step up. They have to be there when their kids do their exercises. If the parents are telling me that they cannot monitor their kids, if the kids are telling me that they cannot do it more than twice or thrice a week, I would rather have them do something else and not with me. Because when it comes to scoliosis, again, this is based on all the researches that we gathered and through our courses as our mentors were able to give us. Di ba nakita niyo yung before and after changes dun sa bata kanina? That was 10 sessions. But despite that improvement, it will not hold. Hindi siya mag-hold forever. It will, if they stop their exercise, mawawala rin yung improvements. And the only way na mag-hold yung improvements mo dun sa exercises na ginagawa mo is if you do your scoliosis-specific exercises for at least, regularly, for at least 18 months. 18 months. If you do it regularly for 18 months. Because yun yung parang landmark mo. Now, once you reach 18 months, once you wean off of your exercises, you will not go back to zero. Your body will have attained the muscle memory and the muscle strength, the endurance to hold your spine in that improved position. Anything shorter than that, then it might not be as successful. So again, when people enroll into my program, how effective is it? It depends on how often you do it. Because the exercises, they work. They work talaga. It's a matter of the people or the people involved or enrolled if they're doing it every day or not. And again, considerations. Other considerations is the degree of curvature. When I say degree of curvature, I've accepted patients up until 90 degrees. In my first course with Shroff, we accepted patients that we treated during the course And we had one kid. She's 20, she's 20 years old, or she was 17 years old back then. She was 17, but her height was parang 3 feet. 3 feet lang, because her spine was so curved, and it really started to deviate her spine. She was really short. And coming to the course, because this was given to them for free, so they were really just required to come, and they didn't have a lot of money, so they went there through commuting, nag-bus, nag-jeep. And the kid was accompanied by a mom and somebody else, kasi yung kid, and she's a girl, she cannot stand alone, much more walk alone. So she was being assisted. That's how bad her spine is. And definitely nasa 100 plus, or I think 110 pa nga plus yung curve niya. And when the mom asked, makakatulong ba yung exercises sa kanya? Sabi ng teacher namin, he was very honest, that's why I like him. We cannot say it will work 100%. Maybe she still needs surgery, but we will keep trying our best and let's see how it works. So we gave her the Shroff exercises, and she was decked to me. She was decked to me. So I was the PT. I was her PT back then. And so I taught her the exercise. The beauty about Shroff is it's just a few sets of exercises. It can even get boring kasi yun lang at yun lang gagawin mong exercise for the longest time. For 80 months, yun lang yung gagawin mo, di ba? Hindi pwedeng baguhin eh. Kasi you have to really work on that. Hindi siya pwedeng pabago-bago. Ang nangyari, so we gave her the program, and because they didn't have money naman, we just told her, oh, we'll just keep checking up on you. And let's see how you are after 6 months, after 1 year. And 6 months, I was amazed that she can stand already by herself. At 1 year, nagko-commute na siya at naglalakwat na siya mag-isa niya. So that was really good. We were not able, she never really got to get another x-ray, because even getting an x-ray was really expensive for them. And so what she did was she just kept doing the exercises every day. And although when I see her in her pictures, because she's my friend in Facebook, hindi pa rin straight yung spine niya, of course, but it has drastically improved the way she lives every day. So in the end naman, I think nobody ever really wants to just get a straight spine, but what everybody really wants is to have that quality of life, right? That quality of life, and that's what we want. And another consideration is yung curve-specific scoliosis, because again, I can get this through the X-ray, because the exercises will vary from person to person. This person, although nakalapat yung hand nila sa floor, parehas, and magkamukha yung pose nila, parehas na parehas, this person can be pushing with the right hand while the other is pulling, while the other one, or the hand at the back of the head, is pushing out to the side or pulling to the back or pushing in. Iba-iba, depends on the scoliosis. Another consideration, again, is the breathing, the derotational breath, that in all of the exercises I give, they should do derotational breathing. Again, ADLs more than anything, because your exercises are just going to comprise of how many hours in a day compared to your sleeping, your sitting, your standing, and of course, bracing. Bracing is important. We're almost there. Kapit lang, mga friends. Scoliosis and telerehab. So we did a partnership, because in telerehab, if you look at our website, www.telerehab.ph, each session, online session, this is all online because we don't want to put anybody in harm's way. Each session is 2,500 online session. But of course, Amanda and I spoke, and we came up with a way to really lower the costs. And if you've scoured already what's available here in the country, Shroff Method exercises can vary all the way up to 3,000 to 4,500 per session. Medyo ganon yung pricing. And I don't know, it's just that I don't know. Ever since I started my clinic, I would always have a patient who I will charge differently. Unfair ako eh. Pag hindi nila kayang magbayad, ba't ko sila pipilitin? Madali naman ako kausap. Because there's this one father, nagbebenta lang sila ng itlog, tricycle driver. And of course, I can't charge them the same way I'm charging somebody who's living in Magallanes or Dasmariñas Village or Ayala Alabang. I cannot. And for some people, they charge the same across the board. But I guess that's because maybe yun yung unfair sa akin because I really try to see and meet everybody where they're at. I don't know. I don't have the heart to make the same arrangement for each and everybody for each and everyone who comes into my clinic. So I would charge them differently. And when I started talking to Amanda, for a lot in the group, they cannot afford Shroff exercises or scoliosis-specific exercises. In terms of exercises, kasi marami naman dyan, di ba? Again, exercise is better than no exercise. Any kind of exercise is better than no exercises. So what we did was we came up with a package, and actually ang Shroff kasi it's really done one-on-one. One-on-one talaga siya ginagawa because there's so much things to consider and so much things to correct that you cannot do the same thing with everybody na sabay-sabay. Kaya hindi siya group class. Buti na lang, yung tita nyo, hindi lang Shroff practitioner. Joke lang. I'm also a yoga teacher. And like I said, I'm also a Pilates and bar teacher. So I'm really used to doing group classes. And I started coming up with a group class for scoliosis na kahit sabay-sabay sila, I just need to assess each and everybody individually at the start. And I'll teach them yung mga Shroff things. Then once we start doing the group exercises, I put in a lot of general exercises that still targets and will help the scoliosis. And I put in a lot of Shroff. I put in a lot of education as well. The pictures that you saw earlier were all, they didn't just do Shroff. They did my integrated program. And my integrated program is comprised of, it's largely Shroff. It's about 70% Shroff. Then we do yoga, but it's not all yoga poses are good, but I choose the ones that are. Then Pilates, I do a lot of core work. Then DNS, I do that because I also learned about DNS and how it can be good for scoliosis. So I integrate it into that group session. And I was able to find success in it, as you can see from the pictures earlier. So yeah, for one-on-one, and I only ever really recommend this for people who really have that severe curve. And when I say severe curve, 45 degrees, di ba? Pag once nag-reach ka ng 45 degrees, severe na yon. You're a candidate na for surgery. But you're a candidate, but it doesn't mean that you need it at 45 degrees because you can do exercises and it already will change your spine a lot. And I don't recommend surgery, not unless you've done exercise with me and nakikita ko hindi talaga nagbabago yung spine mo, then maybe you can go for surgery. But if we can get it through exercise, we will. And one-on-one is directed more to those who are in their 80 degrees, 90 degrees curve. But if your curve is at just 60, 70, it's still big. But you can still definitely join a group class at that curve. For that's for the one-on-one. Again, if it's 80, 90 degrees curve, I would suggest you do a one-on-one because we're gonna have to work on a lot of things. And for the adult group class, what I did was this is walang minimum, walang maximum, and this is really what we Amanda and I talked about, so that it'll be commensurate for everybody. The group class will be composed of 8 people. 8 people, yan yung number. Hindi siya minimum, hindi siya maximum. That's really just the number. 8 people. And I don't want anything more because I cannot spot everybody if it's more. And I cannot go any lower because if we lower, the prices will change and it'll be mas mahal for the others. Now, for the 8 people for the adult group class, it's a package of 10 sessions and each person will just have to pay 2,000. So 2,000 divided by 10. So it's gonna come out as 200 per session. So, di ba? Okay na yun. But for pre-teens or for kids, I really break it down into half pa the number. For 4 packs lang sila. I don't want, because it's harder sa kids kasi I have to change my language with kids. And also, I do a lot of correction for kids because they're still not in that headspace of that body awareness. Hindi pa sila ganong ka-aware with their bodies and how micro modifications can already do a lot. So I just keep them at 4. And again, for 10 sessions, it's 4,000 and it's 400 per session. And this is the rates that Amanda and I were able to come up with. And we've already started. The ones that I have right now are preteens. I have somebody who's enrolled in the one-on-one. I have 2 actually. And we're forming a group for adult of 8 people. But yeah, this is our way of making it accessible for everybody. It's not purely Shroff, I'm going to be honest with you, because I cannot do that in an online setup in a group class. So I inject a lot of what can be done in an online and in a group, but it's still Shroff based, largely Shroff based. And this is one of my kid. He's a boy. He's a boy, guys. Hindi ba halata sa picture? But anyway, he's been with me for about 2 years. And yan yung before picture niya. And this is his most recent one. And we started at 54.79 degrees. And his last x-ray, it was 41.63 degrees. And bumaba siya, 2 years, parang ang tagal, no? Tas ganun lang yung binaba. But if you can actually see from his body, the growth spurt that he went through, you can see, di ba? Hindi lang naman siya tumaba. Pero you can see rin, his shoulders became broad. If you heard his voice in the beginning, medyo maliit. Tas ngayon parang, whoa, laki ng boses mo ah. He went through that growth spurt. So this one was actually pretty darn good considering we started at his growth spurt. So yes, if you have questions, because we're already at 4 o'clock, or hold on, I can answer a few more questions, but just take a screenshot of this, our email, our Facebook, Instagram, and this is my personal mobile. Diba? Personal mobile. Kasi close na tayo eh. You're how many? Oh, you're 98 in the group. We're all close. You can personally message me if you have questions. And I'll try to answer you as fast as I can. And so, yeah, that's it. Thank you, guys. And of course, keep on fighting. And fighting is really exercising and really staying positive. And that ends our discussion for today. And thank you, Ms. Amanda, and thank you, Scoliosis Philippines, for this opportunity to be able to share. And guys, I hope you learned something. And try to come back. If you're gonna start doing something after this webinar, try to practice that diaphragmatic breathing. Try to start doing those modifications for your hips when you sit, when you stand. So those are gonna be a lot. Kesa wala. And thank you
Miss
guys.
Biel. Wow. Wow, that was really lengthy, but
Sorry.
no, but we really parang all these years na sobrang sorry for the world, we were ignorant. Okay? So, it opened our eyes, and I hope everyone learned. And we have plenty of questions. So,
Oo nga, nakita ko, wild.
Rizzy, please do the honor to read them. And
I can read them. I can read them.
okay. So, Miss Biel
Okay.
will do the reading.
I'll read the questions. Oh,
Sure.
sige pa. Okay.
Okay.
Nakaka-affect.
Madami-dami.
Oo nga
Tapos, nasa Facebook Live din, marami ring question, but please choose na lang which
Yes.
we'll just try to
Paulit-ulit na.
we'll just, how do you call this, try to collate all the questions,
Yes.
and then Miss Vial will answer them.
Okay.
As
So I'll start already.
as fast as you can. Thank you.
I'll start already. Nakaka-affect po ba sa scoliosis ang menstruation? Just know, yung menstruation that we're talking about, yung first menstruation, definitely. We call it menarche. Nakaka-affect siya because, again, indication siya ng growth spurt. So, automatic, ibig sabihin, yung scoliosis rin is mag-increase. But, when you say yung regular menstruation monthly, know that your joints are a little bit more supple when you have menstruation. So it will also feel like na mas achy yung likod mo just because all these hormones are rushing in your body at that period of the month. Possible cause ng scoliosis, like I said, 85% of it is idiopathic, meaning hindi mo alam kung saan siya nanggaling. But 30% of it is has a family history. So if you have scoliosis as an adult, as a parent, make sure you start screening your kids as early as 10 years old. Full spine x-ray yung kailangan. Ang pinakamaganda is yung scoliogram. In our Scoliosis Philippines group, there's a ton of information there that Miss Amanda provided in terms of where you can get scoliogram. In terms of a regular x-ray, if hindi scoliogram, it's a full spine x-ray, AP lateral view, meaning it means anterior, posterior lateral view of the cervico-thoracolumbar spine. That way, kita yung buong spine. Is there an age limit to getting benefit for these scoliosis-specific exercises? Would it still be beneficial and can improve scoliosis in the 30s and 40s? I have a patient who's already in her 60s and she's still doing her exercises with me. Definitely. Like to know what specific exercises can a patient who've undergone spinal fusion surgery only do. With regards to those who have already done surgery, of course, we still need your x-ray, and it will still depend on your x-ray what kind of exercises we'll be able to give you. In terms of because if nag-spinal fusion ka na, if you were able to move at 100, or if you're able to bring your spine at dead center, at 0, na wala siyang curve, then that's good. So you might be suffering some pain, some nerve problems. So that's what we'll address with the exercises. If they're not able to bring your spine completely back to a straight line and it still has some curve to it, then we'll start addressing that curve. For advanced form of S-curve with a slight twist, again, we're talking about the transverse plane. You can address it very, very effectively with the proper breathing. Slight pain sa chest while breathing. Again, slight pain sa chest. I want to find out if you're a chest breather. Maybe you have to shift to a more diaphragmatic form of breathing. Yon, upper back pain, again, try to change your breathing. Derotational breathing. What are the possible ways to learn the technique? When it comes to derotational breathing, it's very important that we get your x-ray and we do an assessment. X-ray and assessment. Assessment meaning you have to do it one-on-one because I have to know how your hips have turned, how your ribs have turned. And it's not something that will apply to everybody. Best sleep position pag mild dextroscoliosis. If it's mild, you can sleep in any position. Mild is about 10 to 15 degrees. It's okay. Lalo na if you're an adult. It really it's not a big concern. Um, if you are diagnosed with radiculopathy, is it because of my scoliosis? It can be, they could be tied in. So maybe start doing muna yung scoliosis-specific exercises, then see how it would affect yung radiculopathy or the symptoms of your radiculopathy. The hip affect the length of the leg. Will dropping the hip? Hindi naman. Affect the length. When you drop the hip, this is in standing, right? When I told you to bend the knee, that is higher. It won't change the length of the leg because you just bent the knee. You just want it to adapt, your hips to adapt in that way. And eventually, as we move forward, as your hips become more accustomed, then we'll do a lot more strengthening exercises to keep it in that position. I'll answer just last three exercises, last three questions. If the patient has an S-curve covering the upper and lower thorax, will the sitting position change or help? Yes, the sitting position will also change because, like I told you, if it affected the hips, and it usually does, as you change the position of your hips, the spine will compensate, and that compensation will go up the lumbar spine, and it will eventually go up into your thoracic spine. I was assessed by a spine surgeon 2 years ago and I was diagnosed with 52-degree scoliosis. I was advised to have surgery. Does conservative exercise help my condition? Okay, I'm not gonna say that the doctors are wrong. It's just that the doctors are trained that once they see 45 degrees, they should do surgery. A lot of these doctors, orthopedic surgeons, are not aware that there are things such as Shroff Method and that they are effective. Kasi they didn't train for this naman eh. The doctors don't know everything. They're really good at what they know, but they do not know everything. So at 52 degrees, personally, I will not do surgery yet because that for me is very, very manageable pa. Last question. Safe po ba magpa-COVID vaccine pag may scoliosis? Yes. Yes. It's just a matter of, are you a vaxxer? Are you pro-vaccine or are you anti-vaccine? But for me, it will not affect your scoliosis. I'm pro-vaccines. So yes, those that's the time we have na lang, guys. Amanda, we can save naman the questions, right? So I'll save the questions and I'll
Yes, ma'am. I have a copy po.
Yun. Thank you, Rizzy. And I'll answer them sa group natin, one by one. Because I'm not able to go through them.
Yes, yes, right.
Okay. Thank you,
Okay.
guys.
Okay, so thank you very much, Ms. Viel. We would like to call in Rizzy to present our certificate of appreciation for Ms. Viel um, for today's her generosity for sharing her expertise and knowledge to us. Please share your screen, Riz. Thank you very much, Ms. Viel.
Welcome.
Hi, Riz. You are muted. Please unmute.
Sorry. All right. Um, this certification of appreciation is presented to Dr. Ba? Miss Anne Mariviel Alig TRP for her generous support as our resource speaker at our monthly learning forum series on the topic of scoliosis-specific exercises as conservative management and correction on this day, April 10, 2021, via Zoom web conference. Signed, Amanda Bonifaciamco, founder and president of Scoliosis Philippines Support Group Incorporated. Thank you so much, ma'am.
Thank you so much, Miss Viel.
You're welcome.
Yeah, we would like to ask how, for those who are interested, how do they enroll in your program? Do they can you share the screen again where they can message or
Yes.
send their inquiry? Thank
With
you so
regards
much.
to that, guys, with regards to enrolling for the classes, if you're interested, PM is key. Hindi, joke lang.
Yeah.
But you can go in our Scoliosis Philippines group. I'll start a thread there, and you can simply, what do you call that? Put your name in so that I can see everybody and personally reach out with everybody or with anybody who's interested. But yes, here, just in case.
The previous one.
Yeah.
Yeah.
And of course, Scoliosis Philippines. Just message me or Amanda there. You can personally tag me, DL. And again, I'll start that thread for anybody who's interested.
Thanks everyone for joining us today. This is another Scoliosis Philippines Learning Forum. This is in partnership with Telerehab of Philippines or Telerehab PH. Okay, lahat, pareho kami may PH in short for Philippines. Right, okay, so let's all stay tuned for our next session for coming month. That would be on mental health awareness naman tayo.
Oh, nice.
Because May is mental health awareness. So we are in the midst of a pandemic, so we all should take care of our mental health. All right, so let's all, okay, and say our warmest thanks, pasalamat kay Miss Viel for sharing her time today. And wow, we're overwhelmed, and I think we're having information overload. So let's unmute and say maraming salamat, Telerehab. Maraming
Thank you,
salamat.
ma'am.
Thank you.
God bless everyone.
Thank you, Miss Piel.
Please don't leave yet. Mag-screenshot muna si Rizzy. Please turn your cameras on. You have to show and who is behind this warrior. Ayun, dami. Hello. Say hi. Let's say sabay-sabay kung saan kayo galing. Ako, I'm in Davao.
From Cebu.
Cebu. Aurora. Iloilo. Laguna.
Meron bang overseas who are outside the Philippines now?
Dubai.
Oh, may Dubai. Hello.
Hi.
Wow.
I'm just
From Olongapo.
Hello po.
Wow.
Today
Thank
is
you, thank you.
time
Okay. So do you have any burning question? It's your last chance to ask Miss Viel. Rizzy, are you doing the screenshot na?
Yes po.
Okay, tapos na ba? 3 pages tayo lahat. Wow, it's like how many at some point we were like 100 105 100 over 100. Tapos we have Facebook Live and on the page of Scoliosis Philippines plus the support group. So
Hi, Gabby.
yeah, so everyone is you are all invited for the next learning forum. Okay, so for those who are interested to enroll in the program, for scoliosis-specific exercises. Keep in touch with me and Miss Viel through PH. Okay, so it's been another parang nakakataba ng puso kahit hindi tayo nag-meet personally, but I'm able to reach out to everyone. So this is my way of saying thank you and passing the knowledge. And my is to raise awareness and give the appropriate knowledge on how to fight scoliosis, because we are all in the middle of a pandemic, so we should all be fighting and not be depressed. So next month naman we will be fighting about our mental health. So without far I'm so happy. Okay, so thank you Tel Rehab Philippines. Thank you, Miss Biel. Thank you everyone who joined us today. Stay safe and keep in touch. Okay, so please, we have a live telecast, live Facebook Live today in the page. Please share that. We will be saving the session. We will be we need to reach out to more Filipinos. Yung mga hindi nakaabot sa session today, well, hopefully we'll be able to share and keep on fighting and stay strong, everyone. Together we can. Bye everyone. Thank you.